All right, so this is another video as part of our Achilles Tendinopathy series. In this video, just wanted to run through phase 1 recovery. So we've got 3 main phases of recovery. This is number 1. Before we get into it, just want to sort of give you a bit of a heads up from the outset that because tendons are very slow to heal and repair, because they have less blood supply than say muscles do, it is pretty typical to expect like a 3-month recovery period. So just sort of factor that in, and then even after that recovery and you've gone back to full sport and everything, you still just want to be sort of looking after your Achilles over like the next year or so. You don't have to be as intensive with the rehab or the exercises or the treatments, but you just want to be mindful that that's still like a little bit of a weak spot and it'll continue to remodel over many months. So phase 1 is for when we've got acute pain. So this is more of a reactive tendinopathy, or a recent flare-up of an old tendinopathy. You can get a new reactive tendinopathy flare-up of a more chronic tendinopathy. So this is when you have pain. The way to test it is you do some calf raises. After a while, if you start experiencing pain at 6 or more out of 10, then this is the phase where you start. So it's quite noticeable amount of pain. So our goals here are to reduce pain and allow for recovery and repair, and then we want to minimize the atrophy or the wastage of the muscle, so maintain some level of strength. So in the clinic, we're using distal acupuncture. So distal acupuncture is where we use points away from the affected area. This reduces the risk of irritating an already very irritated area, and it can help a lot with reducing pain, promoting circulation, and helping with the healing process. Chinese herbs may also be useful, and we have certain formulas that can help with these kind of injuries, but also just overall with recovery. Then outside of the clinic, the number one thing you need to do is deload that tendon. So if you're still trying to run and exercise and push through the pain, you need to stop, because you're doing yourself a disservice. You're going to push out your recovery and you're going to make it a lot worse. Tendinopathies are a overuse issue, so you need to give yourself time to repair. So you need to cut out running, any exercises involving jumping and things like that that really load up the tendon. You can swap these out for things like swimming or cycling, or just gentle walking. That's totally fine. Anything that doesn't aggravate the tendon is okay. But you really do need to deload that from normal kind of running. One other thing is don't try to stretch it. Even if you feel like you want to stretch it, stretching loads up the tendon too much, and is not good at this stage of the game. So once you've dropped that down, you can start incorporating isometric exercises to start rebuilding a bit of strength, but also just these exercises can help reduce pain as well. So the isometric exercise you're going to do is you're going to take a calf raise up to mid-range. You don't want to go full range because that can be a little aggravating. Mid-range, and then you're going to hold that there, and I'll cut to another video and demonstrate that for you. But essentially, once you get to a point where you're less than 5 out of 10 pain with those calf raises like you did before, you're ready to move on to the next phase. And you may have a chronic injury, chronic tendinopathy, where you've had it for a while, and you might already be at the stage where you move into phase 2. So yeah, I'm going to cut to the video now. I hope this helps. All right, so phase 1 recovery exercise is isometric mid-range calf raise. So what that means is isometric means you're going to be holding the position, and mid-range calf raise is you're not going full calf raise. That's going to compress the tendon too much. You're going to find somewhere in the middle, and you're going to hold that for 40 to 60 seconds, then rest, 15 to 30 seconds, and then up again, 40 to 60, and you can repeat that 4 to 5 times each time you do it, and you can do this 3 to 4 times throughout the day while you're recovering. This should help reduce pain, so it should not flare up your pain. It's really important you during this whole recovery process, but particularly now, you use pain as your guide. So if anything aggravates your pain and causes a flare-up within 24 hours afterwards, that was too much and you need to do less next time. It's also, when you're doing this exercise as well, if it's too easy for you doing the 2 feet up, then you can progress to doing 1 foot. And you might find that you can do 1 foot for the first 1 or 2 reps, and then it gets too much and then you need to regress back to 2, but you can gradually build up to just doing it on 1 foot. Once you're less than 5 out of 10 pain on repeated calf raises, then you're ready to progress into the next phase.